Assalamu alaikum. First we will put an IV line. As you can see, we have already placed the IV line in the patient. Now we will fix the IV line properly. This is our medicine tray. As you can see, we have prepared the medicine. Now we are giving propofol to the patient. As you can see on the camera, this is an induction medicine called propofol. We have taken it in 20 cc syringe. Now we will move to the ventilation side because we have given anesthesia medicine to the patient. We will now ventilate the patient. After completing the ventilation process for 3 minutes, we will move to the intubation step. As you can see, now we will intubate the patient. We will pass the endotracheal tube ET2 so that the patient can get oxygen properly. This is infusion that we have started. This is the surgical trolley. As you can see, this is a pyodine. Now the surgical staff and doctor assistant will scrub the patient. This is a laparotomy procedure. A patient come to us with abdominal pain and the abdomen is very distant. As you can see, the abdomen is swollen and looks inflamed. This is our cardiac monitor, an anesthesia monitor for patient monitoring. This is the ventilator in front of you, as you can see. The doctor assistant and surgical staff are doing the toweling. The patient has been covered properly. The towels are being placed from one side to the other. These are the scene of our operating theater. As you can see, the surgeon is now wearing gloves. The assistant has already scrubbed so that it becomes easy for the surgeon. The surgeon is now wearing a mask and cap to make sure the surgery can start safely and to prevent any infection. As you can see, the surgeon is fully ready for the procedure. We will now start the surgery and find out what exactly is inside the abdomen that has been causing so much pain to the patient. These are the cartridge we will using for making the incision and for controlling bleeding. Some blood vessels can bleed during surgery, so we use this cartridge to stop the bleeding and to reduce the chance of complication. The surgeon has given the incision and is now using the cartridge. As you can see on the camera, this is the assistant helping the surgeon. This is our operating theater. The anesthesia doctor is standing in front, controlling the patient, monitoring step by step and managing anesthesia. The infusion is running and fluid and medicine maintenance all are part of anesthesia care. The surgeon is trying his best to control bleeding so that no complication occur. This is suction machine. Any fluid coming out from the abdomen will be collected here. The suction is being used to remove extra fluid from inside the abdomen. The abdomen has now been opened. The surgeon will carefully examine what is inside that caused the patient so much pain. Please stay with us and watch what comes out from the abdomen. Even we did not expect this because the ultrasound report showed a perforated appendix. Oh my God, what is this? We have never seen anything like this before. This looks very large, in my opinion. It may weigh at least 7 to 10 kilograms. सही है sir. Even the surgeon looked surprised and concerned. The ultrasound suggested a perforated appendix, but this turned out to be something completely different. The surgeon make a very good decision by giving a midline incision. As you can see, clamping has started. The blood vessels are being clamped and the team is trying their best to remove this mass safely. It looks like a cyst, but we will know for sure once it is completely removed. Oh my god, as you can see, it has turned completely black. This is a very large ovarian cyst. That is why the patient was so much in pain. It is hard to imagine how the patient tolerated this pain for so long. The ultrasound report did not mention this cyst at all. In such cases, a CT scan should always be done to clearly see what is happening inside the body. This cyst has now been successfully removed. As you can see, the closing of the patient has started. The surgeon is taking full care to avoid any complication and ensure a smooth recovery. As you can see the cyst placed on the trolley. It is extremely large. Now the patient will finally feel relief, recover well and alive for normal life again. After surgery, the pain will be gone and the patient will be able to breathe easily and relax.